the microbiome, it's very important to a variety of different health conditions. The more we learn about it, the more we know it's implicated not only in digestive health and skin, but also the mind and mood and even cognition.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, podcast time. We're talking about the microbiome.
Yes, critter time. I love it. You know, there's so much information coming out about the microbiome, and we need to start thinking about it maybe a little differently. We need some help. We need some different perspective. Maybe we can bring someone into the conversation. What do you think?
I think that's absolutely necessary at this point. In fact, if we didn't bring someone in, it'd be kind of awkward, right? Because that's kind of what we do here. We bring in some experts. So
Yes.
Our expert is Dr. Jessica Maloh, and she has completed her Doctor of Naturopathy degree from the Canadian College of Naturopathic Medicine. She's currently a postdoctoral scholar at UC Davis and really focused in on integrative medicine, integrative medical research, and trying to take an evidence-based approach to what we know and what we don't know. And a lot of her work, incidentally, is on the microbiome. Welcome to the podcast, Jessica.
Hi, thank you so much for having me. How are you guys doing?
Doing good. Hey, Jessica, you know, this is such a hot topic. Everybody's talking about it. A microbiome, probiotic, prebiotic. It is buzzing and humming. And, you know, I think we should start maybe with some basics, because I think we all have a sense of what we think about when we think about microbiome. But I think there's a lot of false understanding that has cemented itself in people's minds. And maybe you can help to quickly but more accurately define what is the microbiome.
Yeah, sure. I'd absolutely love to. I agree. I think it's a fascinating area. And I was actually speaking to my friend about this the other day. When I was younger, I wanted to be an astronaut because I was so fascinated by what was out there and how much there was to be learned and the potential discoveries that could be made in our lifetime. And I feel like I have that same fascination with the microbiome. The more we learn about it and the more we see how intertwined it is with different factors of health, I think there's so much to learn. And I think the outcome of that could be very helpful in the future. But basically, the microbiome is a community of microorganisms which consist of not only bacteria, but also viruses and fungi. And they can interact with our immune system. They can interact with the foods that we eat. They can have not only effects on our digestion, which is, I think, how the microbiome is usually thought about, but they're also, the microbiome is also associated with different systemic conditions. And a lot of the research seems to be heading and understanding that.
You know what? You made it to the astronaut level. I guess it's just studying the... I mean, I have to say it since this is probably going to be the title for this podcast. There's no way it can't be, but the universe within, you've gone into the explorations of, I guess, the insides, which is just amazing because we are made up of way more. Hadar, you are more bacteria and fungi than you are a human, my friend.
It's true.
Hey, dude, you say that about yourself. I don't know about me. Oh, yeah, it sounds right.
I'm definitely way more fungi. I don't know about you two.
I like fungi. They're a good time.
Yes, there is a fungus among us, no question.
Oh God, every pun's coming out. Well, Jessica, tell us, I think when we initially thought about the microbiome, a lot of people look at the bacteria. And what do you think is been good about doing that? And where do you think are the limits? And how can we expand research right now to think beyond bacteria?
That's a really good question. And I think understanding the bacteria that's in the gut or on the skin is important information. And we're finding different correlations between diseases and shifts in the abundance of different bacteria. So for example, in conditions like IBD, we know that there could be a decrease in Firmicutes and an increase in Enterobacteriaceae. And we also know in atopic dermatitis, there could be certain shifts as well, things like an increase in Staphylococcus and a decrease in Propionibacterium. But there are limitations in looking at just the bacteria that are there and how we're testing it as well. So for example, the most common way that we test the bacteria in the gut is stool samples. but that might not tell us about what's happening in the more proximal regions of the gut. And so I think maybe future directions of research should incorporate more studies that are looking into more of what's happening in the proximal gut. And also, I think there's a lot of research that's using the 16S RNA to analyze the bacteria, but that may only give us the information relevant to the genus and the species, whereas newer technology and really exciting technology that allows us to do whole genome sequencing will let us be more specific in our analysis of the bacteria and can give us more insight into the species and the specific strains, but also, and I think this is really exciting, is the actual function of the bacteria that's there. So not just how many there are and specifically what the species is, but we can tell how they're functioning by the metabolites that they produce, or if we know that certain pathways are associated with an enzyme and we have the gene for that enzyme, we can start to look for those genes to see where is this bacteria playing its role. So I think it'll be very interesting to keep up with the literature in that regard.
Oh my God, I'm going to date myself, guys. I'm going to make a Smurf reference. And Smurfs, I think, are the microbiome. That cartoon was just about the microbiome. Who are we kidding? That was basically a bunch of microbiota just all blue and doing their thing. When I think about Smurfs, I think about the whole community of Smurfs that are out there. And you have a bunch of lazy Smurfs and they're totally abundant. You kind of assume they're doing most of the work, right? I mean, sometimes what we do right now in the microbiome analysis literature is we say, okay, this was the most abundant, so perhaps it's contributing the most. But you don't know if you have a bunch of little just isolated Papa Smurfs that are just going to town, and maybe they're not the most abundant. And so I feel like your point is a really good one. I think the next level is now understanding how do these communities work to maybe build a certain function or a certain gene that's maybe being overexpressed. Not only that, I mean, maybe this quote minutia players are actually doing a lot of the macro functional characteristics that we really care about.
So I wanted to shift gears then and then ask about current testing that's available on the market, because as mentioned here, there's some limitations to certain testing. Have we gotten to the commercialization of these whole genome sequencing analysis that helps to understand the entire community and also some of the function?
We're not quite there yet. I think we're definitely moving in that direction. And with the gut testing that we have so far, it can still provide us with very helpful information. Again, knowing the relative abundances could also give us insight into potentially diseases that could be experienced by our patients. They're not at the level where they're diagnostic yet, but they do provide that valuable information. And so far, we are able to measure things like short chain fatty acids in stool samples. And we know that the short chain fatty acids produced by bacteria can also play a role in preventing certain conditions or decreasing insulin resistance. And so having a way to maybe track a patient's health would be helpful with that data. But I think to have more functional tests and to really analyze different pathways that are going on is still up and coming.
And you mentioned a little bit about insulin resistance. Where do you think is the sweet spot right now? Which conditions in general are best, the data best support role for the microbiome that's actually can be even therapeutic?
So one good example of using microbiome testing or tests that can tell us about the microbiome is in cases of SIBO. And SIBO is known as small intestinal bacterial overgrowth. And in this condition, patients tend to have an increase of bacteria in the small intestine. And so there are tests like breath tests that can be used to rule in or rule out this condition. And the way that the test works is that we would give our patients a sugar to consume, so either glucose or lactulose, and we would then monitor breath samples every 15 to 20 minutes for about 120 to 180 minutes. And this test operates on the premise that the bacteria in the intestines can metabolize these sugars to produce gases like hydrogen and methane. And in normal conditions, these bacteria shouldn't be in the proximal small intestine, and sugars like glucose should be absorbed, and we shouldn't be seeing a spike in hydrogen. But in SIBO, where the bacteria are there, the sugar is then metabolized by the bacteria, and the production of hydrogen results. So that's one test that can give us some insight and can be used to diagnose. small intestinal bacterial overgrowth. And with regards to treatment, there has been some research around this condition. So the antibiotic rifaximin has been studied and has been shown to clear the bacterial overgrowth and alleviate symptoms. There's also some research around the use of decreased gastric acid in SIBO. And so things like avoiding the use of proton pump inhibitors might be something we try to manage and talk about with patients. In addition, we know that there's decreased intestinal motility that's involved in SIBO. And from a naturopathic perspective, there's some research around the use of 5-HTP to help stimulate intestinal motility. And with regards to diet, that's very important to talk about, of course. So the low FODMAP diet, though it hasn't been studied specifically for SIBO, has been studied in cases of IBS, irritable bowel syndrome, and there is some overlap between the symptoms of IBS and SIBO. And so that might be something we also recommend to patients and see if there's an improvement in the SIBO symptoms, which include bloating, distension, abdominal pain, diarrhea.
Jessica, I mean, I think that's a fantastic overview of SIBO and like one example of where microbiome testing would be very useful. Now, what do you think are going to be, just kind of taking a step back and saying, you know, as a clinician, if you're going to be choosing a test, say it's whole genome sequencing or it's going to be 16S, first of all, how can we make sure that clinicians know the difference and why should they care about the difference if they're going to be making decisions for their patients down the line?
So I think it is important to know the difference, and it can be relevant into the findings that we have from research and how we're able to incorporate that into clinical care. A great way for clinicians to learn about it is through LearnSkin, where we summarize up-to-date research and present them to the audience. So that's always a great place to start. But with whole genome sequencing, like I mentioned before, it can be more specific. So it can tell us more about not just the species that's in the sample, but also the strain. And this could be relevant because even with studies around probiotics, we're finding that there are differences in the effects of probiotics within the same species, but depending on the strain that they are. So it could be the same species, but they're a different strain, then they could have very different effects on how they modulate the immune system. And within the same species, one could push towards a Th1 response and one could go towards a Th2. So I think it is relevant to know not just the species, but also the strain. And like I mentioned earlier, with whole genome sequencing relative to 16S, we're able to get information about the function of the bacteria. So are they producing metabolites that are beneficial, like short chain fatty acids? And are they involved in certain pathways that are inflammatory or anti-inflammatory? And based on that knowledge, we can have a better idea of how do we support the growth of these bacteria? How do we help push them in the direction of being involved in this pathway?
Thank you. No, absolutely. And one of the areas that I think is exciting, just, liking skin at all, is that the skin really carries a lot of the microbiome. And I think although more studies are needed, there is some promise in using the skin microbiome as a biomarker for disease severity, for example. There's some emerging evidence in atopic dermatitis, for example, and using Staph aureus that has been implicated in the pathogenesis of atopic dermatitis, trying to understand that relationship as a biomarker, actually, looking at the number of bacteria that are there and the prevalence and various species. There's some data emerging on that. For example, it's been noted that there's less Staph aureus when people are doing better on certain treatments. So using the skin microbiome as a biomarker, I think, is a great opportunity. Any thoughts on that?
Yeah, I agree. And I was going to add that with atopic dermatitis and Staph aureus, like you mentioned, it's lower when the skin is more calm, but potentially we could be able to predict flares down the line because we know that when there is a flare in atopic dermatitis, Staph aureus and Staph epidermidis tend to increase. So that could also give us some insight into how our patients are doing and help us be more prepared to manage their symptoms.
So one of the things that I wanted to slightly change gears, because I think you both are really hitting the nail on the head when we're talking about the microbiome and perhaps the skin, but even in the gut and the functions and whatnot. But I wanted to be a little bit more global and ask a question, and maybe this harkens back to some of the principles that have come out of Ayurvedic medicine, traditional Chinese medicine, where they look at gut health and the gut as being a seat for health elsewhere in the body. How do you think the information that we're learning now gives us better insight into, say, the gut-mind connection or the gut-mood connection, or what other gut connections are we starting to be able to explore because of the research that's coming out?
Yeah, the gut mind connection is so interesting to learn about. And we know that there is this gut brain axis and that they're connected with the vagus nerve. And there's also emerging research that shows when there's dysbiosis in the gut, it leads to inflammation that could also then affect different cognitive functions, behavior, and even mood. And what's really interesting too is that the bacteria in the gut are known to produce neurotransmitters and neuromodulators. And so this could be relevant down the line as well, because we know bacteria like lactobacillus and bifidobacterium could be involved in the production of GABA. And so in conditions of anxiety, that could be something to also look into.
So, do you think that in the future, perhaps we can treat certain mood disorders by providing prebiotics or probiotics?
Yeah, I think that can definitely be something that we're able to help patients with in the future. Again, we'll have to keep up with the research and keep doing the research to really know, but it is a promising area, I think. And it would also be really interesting to learn more about how the mind and psychological stress can impact the microbiome. So the opposite direction. And, do states of mindfulness help to promote the growth of healthy bacteria? And do states of stress shift the microbiome in a way where there is more inflammation and can be more aggravating to digestive complaints?
What an interesting area. I have a really interesting phrase that one of my attendings from derm residency taught me. There's deductive reasoning, but he always talks about seductive reasoning, where it's like you want it to be something that we explore, or like it's very juicy to think about it. I think it would be so interesting to look at mindfulness. And is there any studies out there, Jessica? Do you know, like the whole, like around love or around gratitude? Have they looked at how microbiome shifts may occur, may not occur? And, maybe perhaps it's related to stress, but I'm curious, is that something that's been explored?
There is some research around psychological states and the microbiome and inflammation and how it could have adverse effects on different digestive conditions. But there hasn't been any, to my knowledge, that's looked at mindfulness and gratitude with respect to the gut microbiome. So I think it would be really cool to have a study one day where, maybe patients do an 8-week mindfulness-based stress reduction program and we look at their microbiome, the diversity of it in the beginning, and then maybe we see how it changes throughout the program, compare it to the end, and see if there's an increase in diversity or an increase in the anti-inflammatory bacteria. I think that would be really fascinating to examine.
Yeah, exactly. I think that would be really fascinating. You've been looking into, I want to hear your thoughts on this. You've been also looking into, not let alone the state of mind that you're in, but the food that we're eating has this beautiful interplay with the microbiome, doesn't it? Because I've been reading more and more, and I want to get your take on this, that sometimes you have to have the right microbiome set up or the right organisms present to be able to get the benefits of certain foods. I mean, there was a recent study looking at the load of Prevotella in people as opposed to, other non-Prevotella bacteria. And the study showed that if you had more Prevotella present, when you were given fiber, you lost more weight than if you didn't have any Prevotella, known as the zero Prevotella group, or a low ratio. You couldn't lose weight as easily when you were eating fiber. So I feel like the nuances are going to change. What are your thoughts around this, Jessica?
Yeah, it's so interesting. And I think there's definitely more that we're learning about in that area, even things like polyphenols. And, patients are so interested in different supplements that they can take and how they can improve their diet to get these health benefits. But you've raised a really good point in that sometimes it depends on the state of the microbiome and whether or not we're able to metabolize and digest these supplements or dietary changes in a way that's going to exert the benefit. So I think that's where gut testing can come in and potentially it can give us some information about let's shift the microbiome, maybe with the use of probiotics, to get the patients to a point where they can now make best use of the dietary habits they want to implement or the supplements they want to take.
I think one of the important issues that we have to deal with is what are the right questions to ask looking forward into the future of research in microbiome? because now we're getting more and more capability, right? We're developing all these sequencing abilities. We have computational abilities that we never had before to try to put all these trillions of numbers together to try to identify trends and then their relationship. So now that we have the tools, the question is, what is the best use for that? So what is your take on that? And Raja, you've done a lot of work in that as well, so you should also comment as well. What are the right questions or the important ones, the highest priority questions we need to ask when it comes to the microbiome of the gut, the skin, that we're not asking just yet?
I think one of the places to look into is how the microbiome shifts in each person. That's definitely one of the topics to consider just because it can be so different within each person. So recommendations we make should be guided towards that particular patient. And like we mentioned with diet, how they're going to be able to metabolize that, if they're going to be able to metabolize that to get the best benefit. And perhaps if there are certain disease states in a person that's more Th1 dominant versus Th2 dominant, that's also really good information to have to know which kinds of strains of probiotics to recommend to them. And so I think in the future, being able to get to that level of specificity in a very personalized way for our patients could be important.
I think one of the core questions that comes up really is, what does the scientist care about and what does the clinician care about? And I think sometimes we mix those together and err on the side of the scientist. But I think we'll start to see that if you just focus on the scientific questions without understanding clinical nuance, you're going to be generating a lot of data without having a clinical application that will have to come in on the back end somehow. And let me be more specific. I mean, we can find all these really interesting ratios. I mean, they have Acinetobacter versus Proteobacter, or Prevotella versus Bacteroides, or Firmicutes versus Bacteroidetes. You can find all of these in diversity and perhaps like Simpson, or if it's going to be some alpha beta diversity measure that you're going to do. You can have all of these things that are being put up there. But at the end of the day, if you wanted to make a difference in clinical medicine, I think the question needs to go to, okay, so what? Like, okay, so you have this, now what can you do? Can you change the diet? Can you change perhaps a supplement that you're going to give someone? Does it have implications for any sort of treatment paradigm that you're going to give someone, whether it be hidradenitis suppurativa, or perhaps it's acne, or it's going to be diabetes, or the holy grail? Can you take something and say, okay, you have a skin issue, you have a mind issue, and you have a gut issue. Let us formulate something that's going to take all of that and incorporate one plan that will now be holistic. And I think that that's going to be the challenge. And I think the scientists need to work with the clinicians, because the clinicians don't know the science well, but the scientists don't know the clinic well. Sometimes we fall back and say we need to have clinician scientists, but I think the answer is you need to have both of those people talking. You can't just have the clinician scientists doing all the work, because then it's still very research heavy, and you need to focus on clinic as well if you want some clinical outcome that's going to make a huge impact. And you need to ask clinical questions. I think we need to start moving towards clinically driven endpoints with the microbiome, not just organism driven endpoints. And so hopefully we move in that direction, and it will make all the difference in how we think about postbiotics, probiotics, prebiotics, whatever biotics, and it'll change the landscape. But to do that, we need to have clinicians at the table, and they need to understand how to use this stuff, or else it's just going to be the lore of science.
And Raja, I agree it's a holy grail, but I don't think it's such a fantasy to think that a lot of the conditions that we're treating are really connected. If you look around, you see there's so much overlap between various etiologies of disease. You mentioned hidradenitis suppurativa and inflammatory bowel disease. There's overlap there. There's so many other overlaps that exist, and we kind of see it types of people trying to emerge these patterns, and the patterns can exist in the microbiome as well, and that may explain part of the variability that we see. I think your point is well taken there. I wanted to take the discussion maybe on a slightly different slant here, because until recently I was thinking of the microbiome as existing mostly on the skin and in the gut, and kind of by proxy, as Jessica explained to us, affecting other organs, as Raja was mentioning the brain. But I was recently reading very early emerging data that actually many of our organs, like liver and even the brain, have their own microbiome. Certain microbiota populations have been found there. So I think that opens a whole new area of research and understanding on those relationships. And how did the gut microbiome get to the brain? What is it doing there? Why is it not an infection, right? And what are we doing in our lifestyle that is leading to that? Because I have no doubt, going back to your point, Raja, that most of chronic disease in Western society is driven by lifestyle. And so now that we're starting to see this, I wonder if there's a role there.
Absolutely. Completely agree. And I think it's especially important to look at those lifestyle factors that we can talk to patients about and to learn more about how the lifestyle factors can affect the microbiome. So not only diet, but what about physical exercise? By doing physical exercise, are there certain shifts that we see? And to maintain those shifts, how often should we be exercising? So I think the more that we know, the more specific we can be with the recommendations that we make.
Yeah. And one of the things I think the microbiome research has really opened up is it's opened up this conversation around integrative medicine. And I think you both will agree, like prior to this, people used to say you had to absorb nutrients at a certain level and just taking low grade amounts just didn't make any sense. And of course, anytime you think you know everything, you get a big wrench thrown in there and you're like, well, turns out that all the bacteria in your gut actually did live off those smaller amounts that maybe weren't absorbing at high enough levels because they were modulating some part of the biology. Now, I think more than ever, we have to stop being in silos. We're going to have the naturopathic doctor working closely with the allopathic doctor, or the Ayurvedic practitioner working closely with the traditional Chinese medicine, all of them sitting in the same room and saying, okay, there are certain things that we understand from disease pathophysiology, maybe biochemistry, but what about the botanicals and the botanical approach? And what about those active agents and supplements? And hey, what about those gut health principles that we've been using in Chinese medicine and in Ayurvedic medicine for thousands of years? Do these all go together? And I feel like we finally have the opportunity to have this conversation in a scientific way, evidence-based. So I've just been super excited that this is an opportunity that's been handed to us in integrative medicine. And I really want to make sure that we all take full advantage of it.
I agree 100%, as you know. And what a better place for all these people to meet in the Integrative Dermatology Symposium. And I really think that the challenge will be maybe to bring some of the scientists there, because we certainly have the clinicians there discussing at least what pertains to skin. But I think bringing some of the scientists who are doing this work, specifically around microbiome, could be an interesting way to develop these holistic interventions, both in diagnosis and treatment.
Well, Jessica, why don't you give us some overall thoughts about the microbiome? Where are we headed and how should we be thinking about it?
Sure. Yeah. So overall, the microbiome, it's very important to a variety of different health conditions. The more we learn about it, the more we know it's implicated not only in digestive health and skin, but also, like we talked about, the mind and mood and even cognition. So it's very important to continue researching, to continue keeping up with the research and where we're heading. I think the more that we'll know, the more we'll be able to make recommendations about diet to optimize the microbiome as well. I think we are headed in a direction where we're learning more about the use of prebiotics and probiotics and their benefits. And I think it's going to be a really big part of the future of medicine. And like you mentioned, I think it's a really great point to allow for integrative care if we can all come together, MDs and naturopathic doctors and researchers and TCM practitioners. We can all ask these really great questions that can help contribute to where the research is going. And we can put all our skill sets together to optimize patient care.
Well, I mean, I couldn't have wrapped it up much better than that, Jessica. And with that, I want to really thank you for coming on, giving us your thoughts and your expertise. We look forward to learning more about the microbiome, and hopefully we'll have another conversation in the future where we'll be talking about clinical recommendations not too far in the future.
That would be fantastic. Thank you so much for having me. I was really looking forward to this podcast, and I'm so excited for the microbiome CME series to be up. I can't wait to share all this information with everyone.
Yeah. So Jessica, before we end here, tell us about the series. What is the goal of the series and what are the kind of topics that people can hear about?
Yeah, absolutely. So the microbiome series, as titled The Microbiome and the Universe Within Us, as I explained, I really do feel like it's this universe, and how cool is it that it's within us and on us. But some of our courses will talk about the very basics to start with. So what is the microbiome? Why should you care? But then we also dive into gut microbiome diagnostics. We talk about probiotics and what you should consider when you're recommending them. We talk about SIBO and its systemic associations. We talk about the gut microbiome and mood, herbs in the microbiome. We even talk about wound healing in the microbiome. So there's a lot to learn. It's very exciting.
I wonder who did the wound healing one.
Sounds like my kind of series. I like it.
Well, on that note, thank you so much, Jessica, and we appreciate your time.
Thank you so much. I really appreciate you having me on.
Thank you for tuning in to today's episode with Dr. Raja and Dr. Hadar. This podcast is brought to you by LearnSkin, leaders in integrative dermatology education. Visit learnskin.com/podcast to explore our many programs or subscribe to the podcast today and never miss an episode. Hey, have a great day and stay curious.